doctor, how vital are these movements right after?
Very, very important, not only after surgery, but really for any person who is affected by arthritis. We are going to notice a lot of the things that Sonia was talking about. You know, when you first wake up in the morning, that joint just doesn't want to move. It feels very stiff. It feels very hard to take those first few steps. So the more we can keep our joints and our muscles flexible and moving, the better we're going to feel. So therapy, it really is the cornerstone of treatment for many of our patients with arthritis, in terms of allowing them to maintain or improve their quality of life, as we were saying before. We get more mobility, we get more muscle strength, we get balance, we get flexibility. The benefits are there, and the benefits of exercise almost always outweigh the risks.
Absolutely.
They're very important to know that as well.
And what kind of exercises do you suggest, doctor? Can you give us some examples of what you think would be a good plan?
To me, the most important thing, you have to find out what's going to work for you. What is going to be that exercise program that is going to allow you to, number one, stick to it, and number two, get the benefits that you want to get from it, right? For example, you know, right after surgery is perhaps not the best time to go run a half marathon or try to do a squat.
Look at Sonia laughing.
Or if you're having, you know, she probably wanted to, right?
She probably was ready. I'm going.
Yeah, but you know, so that's very important, that personalization, that finding out what works for you and going with it. But in general, you know, when we have someone who's very symptomatic, we want to start with range of motion exercises and with low impact. So anything inside a pool, perhaps a bicycle, perhaps trying a little bit of that elliptical machine, with less ground reaction forces on the floor and less forces being transmitted to your joints, especially your weight-bearing joints. We're talking about ankles, knees, hips, and spine. And then progressing and building on that. So developing a strong foundation from that low impact exercise and a bit of resistance training, which is really important to develop those muscles, and then essentially progress from there and run with it.